I'm Leanne West, and I wanted to welcome you to today's Tech Talk with Maribeth Coleman. We're going to learn some really interesting things about her research, and I am going to let Maribeth introduce herself.
Hello, thank you, Leanne. Thanks for having me here today. So I'm a principal research scientist in the Institute for People and Technology. I also have an appointment in the College of Computing because I'm a computer scientist. But I work at that human-computer interaction level. So I'm really interested in what happens when the technology and the human come together. And specifically, I do, for 25 years now, I've been doing research in augmented reality, virtual reality, and wearable computing. And I'm often applying those technologies to healthcare, both to support healthcare personnel, but also to deliver healthcare interventions. I also work with assistive technology, so how to use these new innovations to promote access and inclusion. And I've been working with Leanne, I think, for about that same amount of time. So yeah, excited to talk about our work.
Great. So I forgot to say what we were talking about today. Cognitive AR, manipulating augmented reality to enhance healthcare work environments. So I think this is really interesting. It's kind of a next generation of what Maribeth has been working on, I feel like. So Maribeth, why don't you tell us what cognitive AR is?
Sure. So in general, this term augmented reality, it's used in a lot of different ways, like in the commercial space. But for researchers in this community, it means putting virtual content into the physical world. Often that's visual content, but it can be auditory or tactile as well. Specifically, when I say cognitive AR, what I mean is not just kind of adding new content to the world, but rather using AR interfaces to mediate between the environment and the human. So there's a bunch of information and signals that are naturally coming from the environment. Let's say you're in the ICU, right? There's virtual sounds being created by equipment. There's natural sounds of people talking and doing activities. There's all kinds of visual information from the physical environment, also being, readouts on machines and things like that. So there's a whole bunch of information coming in. And cognitive AR, the goal is to diminish, enhance, or remap those signals in a way that promotes attention, allows people to focus their attention where needed, also reduce cognitive overload and stress. And so in an environment like the ICU, this could be very valuable, right? An environment where people suffer from alarm fatigue, where they struggle to exclude irrelevant information, but then be situationally aware of the relevant signals. So this is creating multimodal interfaces. That means vision, sound, and haptics to present those signals to you in a way that's going to help you. And so diminish is what it sounds like, right? So it's perhaps reducing elements of the sound or the vision so that it's not so distracting, but retains the information that you need. Think of like noise canceling headphones would be a very simple example of diminishment. Enhancement might be putting a virtual glow around the equipment that you're currently operating, or the next piece of a tool that you need to interact with. And then remapping would be taking information that's coming over one sensory channel and mapping it to another. So that could be perhaps muting the auditory alarm that's being played in the environment, and instead presenting a visual signal, or perhaps a haptic, like a vibration on a smartwatch, to remap that information for you.
Very cool. All right. So can you tell me about multiple resource theory and how that plays into what you're doing?
Yes. So I often collaborate with psychologists on this work, because we don't want to fall into the trap as technologists of just creating cool augmented reality things because we have this intuition that they would be good, right? We want to base our AR designs on established models of cognition. And so I'm doing this work in collaboration with a human factors psychology professor, Dr. Ann McLaughlin, who's at NC State. And she and I have been working together for years. And specifically with this cognitive AR, we're basing our designs on this multiple resource theory. And in short, this is the idea that, so we have these different sensory channels that information comes into our brains. And then we're also categorizing that information as like spatial information or speech information, no matter what channel it came in on. And so the way we avoid overload is making sure, like, you will become overloaded if too much information is coming over the visual. But you could ameliorate that by moving some of the information from visual to auditory. So part of our research is understanding like how we could understand at any moment whether someone is at risk of being overloaded, and then making these informed decisions within our system of how to diminish or remap, based on that model.
Cool. What are some of the scenarios that you can imagine using this in, or what scenarios are you working in right now?
Right. So we have multiple projects going on that are funded both by federal grants as well as industry. And so we're actually exploring three quite different contexts. One is the classroom environment. So particularly for students that are neurodiverse, right, that might be particularly prone to being distracted or stressed by a lot of stimuli in the classroom setting. So exploring how we could do this mediation to support them being able to focus on the teacher, but again, also being aware of what's happening around them. You don't want to just have them look through a toilet paper tube, and have big earmuffs on. Then we're also looking at, some of this is funded by NASA. So how could we use this in the space station and on the Mars mission, where particularly in context where crew members might be trying to do difficult tasks under these extreme kind of emergency settings, where there could be all kinds of things happening in the environment, alarms, fires, all kinds of noise, stuff floating through the environment. How can we help them focus attention? And then third, and most relevant for us today, is nurses in the ICU. And there's a lot of established research showing, kind of analyzing what are the moments that cause nurses to experience like an excess of stress, or that are particularly challenging, in terms of maintaining, quality of care and things like that.
Yeah, so the ICU environment is definitely very stressful. There are a lot of things going on at any given time. Can you tell us a little bit about how you see nurses using this and how it might work for them? Like maybe what are some of their pain points that you would address using this technology?
So a lot of the pain points are related to the requirement to multitask and to task switch. And humans, even though we feel like we can do multitasking, we're actually really bad at it. Even the digital natives that are supposedly good at it. And so, yeah, particularly those scenarios where, the nurse has kind of a set of things they need to accomplish over the next set amount of time or throughout their shift. But you never know moment to moment what is going to intrude on that plan. And they may be required to maintain this awareness of multiple patients, right, and their status, and may be called away to deal with, emerging needs of differing levels of urgency, right, and then return to a possibly complex task that they were in the middle of. So using this both to focus attention while they're doing a particular task, but also letting them maintain that appropriate level of awareness while maybe diminishing some of the additional signals that at any time are just distracting. And well, I'll stop there because I know there's some subsequent questions that'll dig deeper into that.
Okay. So one thing that I think is really important when we're working with clinicians is to actually, and patients too, is to listen to them and really understand what their needs are, So what kind of things have you been hearing from nurses about what they would like to see?
Well, we have definitely heard that, this job is extremely taxing, cognitively and emotionally and physically. And I think there's an opportunity, even if yes, the nurses are, their performance is outstanding, it's taking this toll on them. So how can we make it so that they're able to get through that shift, and maybe not have that be so drained, daily by this work, and, getting burned out eventually. We also hear there's a lot of, the other reason that we do a lot of participatory design with our stakeholders is to understand, like, what's realistic in terms of what kind of devices can they have, what things can they interact with, what sort of interfaces are realistic, given that they're using their eyes, their ears, their hands to do their actual work. And of course, all the requirements related to, maintaining sterile field and such. So it would be a mistake for us to just kind of cavalierly start building tech and thinking, oh, here, take this. This will solve your problem. We really need to do this co-design with them.
Absolutely. And so you mentioned interfaces. What kind of interfaces are you thinking about to help nurses prioritize all of this information that they're getting?
Right. So it's, increasingly common that they might have a mobile device, so that's one platform, both for sensing and also for delivering information. There's also the possibility that they're have or are able to wear a smart watch. Increasingly there are ways of delivering personalized audio that are not intrusive. I mean, you would not go through your shift in the ICU wearing earbuds, right? But bone conduction headphones are a possibility, where it's a small speaker that's actually just touching your head and it's vibrating your skull instead of blocking your ear canal. So there's opportunities there to deliver, personalized audio that's not distracting to the wearer, but also not distracting to everyone else in the environment. There's certainly the possibility of using a lightweight heads-up display, something like Google Glass, although, we really want to make sure that we're creating designs that are realistic. So, in some of my research, I've got people wearing HoloLens or other full immersive AR displays. Clearly, that's not going to work right now in that environment. So cheap, light, long battery life sort of visual displays are a possibility.
Yeah, really interesting. And I think, one of the things you said was, they're not going to be wearing headphones or big displays or anything like that. And I think, one, they couldn't do it and really do their job well, but two, I think it might scare some of the younger kid patients. Either that or they would think it was really cool. I don't know.
I think it could scare all ages of patients.
Right. And so for these interfaces, I'm assuming that there have to be some other considerations taken into account, like because you want to use it in this environment that does need to stay sterile, or they may have other protective gear that they have to wear for what they're doing. Can you talk a little bit about that?
Yeah, so all three of these environments, there's a lot of different considerations. Obviously on the space station or in the ICU, there's a lot of very serious requirements, both to keep the user safe as well as to fit into the appropriate environment. They may be wearing other PPE and things like that this interface needs to be integrated into. There's also social considerations. Certainly in the classroom, both what would the student be comfortable wearing, right? So would they be comfortable wearing a head-mounted display? I think some of the learnings from Google Glass deployments was that might not be socially acceptable, at least kind of with our current, societal views of such things. So what would they be willing to wear? And also what sort of interactions would be socially acceptable? If I'm sitting in this classroom, I don't want to be certainly not using speech recognition, right? But even, is it okay for me to be tapping the side of my glasses? Like that's the Google Glass sort of interface, tapping and sliding, or doing something on my watch, or we wouldn't want to be asking the user to do interactions that make them feel uncomfortable or drawing attention to them or disrupting the class. And like you just said, this would be certainly a consideration in the ICU as well. I think sometimes people imagine, oh, well, if you're in some sort of industry setting, industrial setting or work context, that you can take that social part of the equation out. But similarly, if nurses felt conspicuous or silly interacting with this technology, it would quickly be rejected. And as you also mentioned, you've got to consider what is the experience of everyone around this user. And that was some of the learnings from Google Glass, right? I don't think the engineers, although it's an amazing feat of engineering, they maybe didn't quite think, how is everyone around this wearer going to perceive this system? And are they going to think it's spying on them and it's recording video and streaming it somewhere? And so those are additional but fun challenges. That's one reason I like to work in wearable computing, is because, it's one thing to design a gray, PC box and monitor that's going to sit on a desk, but it's a totally different challenge when you're trying to integrate these devices and interfaces in, like, literally onto people, and into the community, where there's a lot more considerations.
You're right. I mean, that's definitely more fun than just looking at a box on a desk, for sure. So thinking about the nursing situation too, and prioritizing these signals that they might be getting in these alerts, what kind of risks are involved with this in this healthcare setting particularly?
Yeah, certainly. We have to design this in a way that it's fail safe. We can't have the scenario where something is being diminished that needs to be received. And so part of that is just kind of designing these heuristics in a way to always default to just presenting you with everything. When in doubt, just present everything. Two, a certain level of priority information you would just never mess with. They're just going to receive that as normal. And three, the interface is part of this equation too. So at the very least, the user needs an incredibly quick way to just turn it all off. Like, I don't want, this is impeding me. I don't want it to be doing anything anymore. But ideally providing some more nuanced controls so that the user is very quickly able to kind of tune the level of mediation based on their preferences. And, these are professionals that know what they're doing. We need to defer to them to kind of decide at any time what they can handle and what they need to know.
Absolutely. And so thinking about you doing this research, how are you conducting this? I'm kind of guessing you're not starting out with a Google Glass in the ICU just to give it a go and see what they say.
Right.
How are you able to do this research?
Yeah. And, this was actually maybe a silver lining of COVID, because all of this work started like this day 2 years ago, right? Which I think was the last day that I came to campus before it all fell apart. So actually what we've been doing is building a virtual reality test bed that is a proxy for these physical environments. So, we have a classroom version and a ISS version and an ICU version. And then that allows us to have ultimate control both over this physical environment, and it also allows us to present augmentations perfectly and exactly how we want them. Because there's some of these fundamental questions we need to answer around when and how do you diminish, enhance, and remap. And we have our hypotheses based on this multiple resource theory, but there's still a design element to that. When I say remap, like, okay, I need to remap from visual to tactile, but exactly how? right? And so we need to answer those questions. So this test bed gives us a way both of doing this kind of co-design with our stakeholders. So it's an environment that we can very quickly implement things, have them experience it, and then go back to the drawing board, and also a way to run very controlled scientific experiments that will give us this fundamental knowledge of human factor psychology and also and HCI. So the ultimate research questions are around, does this concept, is this even helpful? And if it is, what are the guidelines? The overall like intellectual merit of this work would be providing information to the community, kind of like a recipe of this is how you should mediate different types of signals in these different contexts, so that it could inform a whole, ecosystem of future kind of cognitive AR interventions.
Definitely. Very interesting. Is there anything that you want to talk about that maybe I didn't ask you about, or does anyone else in the audience have a question? And
Yeah,
you can either raise your hand or type it into chat. All right. Hearing and seeing no questions from the people in the audience. So just back to, is there anything else that you wanted to talk about with this? Are there other realms? I mean, you've talked about the space station, which is very cool. The space program is why I went into physics. So I think that that's fascinating. Talked about kids in the classroom who might have problems focusing. I think that's a great pediatric application. Nurses in the ICU, that could be adult or pediatric, really important for both. Are there any other scenarios that you can think of that might be interesting for this type of technology?
Well, when we were discussing this yesterday, Leanne, you were kind of bringing up some ideas I hadn't really thought of. We kind of were riffing on that idea of helping the kids in the classroom and thinking about, kids as patients, where perhaps this could be used to, help maybe diminish some of the stimuli from these healthcare environments that are scary or stress inducing, and instead helping them focus on the elements of the experience that are positive. I mean, I could even, so now I've got a lot of ideas in my mind. Also, maybe how this could support younger patients as they're learning how to manage their own health, or trying to learn. I'm thinking of maybe like a patient who has newly diagnosed with diabetes or something like that, and they're trying to learn what they need to do in their daily life to manage that. Perhaps this could be, something that could help.
Yeah, and we do have a comment in the chat from Evan, and he says, yes, this is what I thought you would be focused on, how to make the inpatient experience less stressful. So I think that that's really smart, and I'm glad that we've kind of brought that to your attention while you think about these things. We also have a question in the chat. It says, Maribeth, are there successful augmentations that are already at the implementation stage in the ICU or elsewhere?
Not yet. We're still doing that fundamental research. And there's quite a chasm to overcome to jump from running these experiments, especially in the healthcare setting, to then have something that you can deploy safely in the actual ICU. So that will be a process, and we will need much more money from NIH probably to get there, or funding from industry sponsors. Some of this current work is funded by Cisco, and that's absolutely their interest. So there are industry partners that would ultimately want to make these kind of products, right? So, but yeah, so there's a ways to go till we reach that goal.
I do think it's really interesting, and if you could help solve some of these problems for nurses and patients, that would be fantastic. Because it is, I mean, if you stand in the ICU, there's signals everywhere. It's, you feel kind of stressed out or chaotic just being a part of it sometimes. We do have another question from Evan. It says, also for we clinicians in the ICU setting, our roles vary with the day/census. So developing tech which enhances one specific role would be interesting. And so that's more of a comment, I guess, than a question.
Right. Well, and that's actually the core motivation behind the NASA project, because, you've got this limited crew, on the space station. And yeah, they're highly trained and they're all trained on everybody else's jobs, but ultimately there's like an expert in each thing. And the scenario they're most concerned about is the physician on board is the one who is incapacitated. And so now someone else has to step in and perform some medical procedure. And so although they will have received some training, it's not their, core expertise. And you're trying to recall this past training in this incredibly stressful moment. So yeah, anything related to task switching, I think it's a prime use case for this.
Good. And I see that I missed a question earlier, and this will probably be our last one, but we could stay on a little longer if there are more questions after this. The patient and the family experience is a strategic focus for most healthcare providers, especially pediatrics. Are you working on the bridge? Are you working on bridging the gap with the transition of care?
Well, so that's a very good question. And I think that's actually, that would cue up another talk from me, because I didn't kind of talk about there's another component of this work that we call contextually aware notifications. That's about not this mediation between the environment and the human, but trying to understand when is the right moment to present information, specifically being able to use machine learning to predict when is someone available to be interrupted, and are they available to perform the specific action that I'm about to present them with, whether it's, entering some information or going and researching information or talking to someone, or it could be physical tasks, informational tasks, communication. And we specifically are looking, one of the use cases for that is like continuity of care. So being able to provide this kind of cognitive support to when the person is now leaving the hospital or the rehab facility and they're coming home and they've got a support network that's trying to figure out what needs to be done and handle all of these additional duties, having this kind of coach that's there helping them do it.
Yeah, I love all of this. I think it's so fantastic. And I can see how this is really, it's going to be the way things are done in the future. It almost, it's just the way that things are evolving. I think it's really, really interesting. So thank you so much for being here today with us. We're at the end of our time, and but we really appreciate yours, and this was just fascinating. So I really enjoyed it, and I appreciate everyone who came today and listened. And this will also be available as a recorded session on our website if you want to share it with anybody else. So thanks, everyone. Thanks so much.
Yeah, thanks. Bye-bye.